Welcome to the Hank Cisco Show, and we have another guest, a very special guest, that's stationed here in Norristown at Montgomery Hospital, and she has been in Norristown for over 20 years, going on 21 years, and can you imagine coming into Norristown for 21 years in and out, and a lot of people don't get to know her, but you're going to get to know her, okay? And her name is Estella Greaffe, right?
That's correct. Greaffe.
Greaffe. Okay, I want to make sure I get the right. And she's in charge of radiation oncology at the Montgomery Hospital, and that has to do with what? Cancer.
Right. I'm a cancer treatment specialist, and radiation is the tool that we use for treating cancer.
That is so important today. So not only to get to know her and her family and what she does and some preventions and things that we can help each other because today it's a big thing. So, doctor, tell me something about yourself now. Let me tell you, you got a family. Tell me all about your...
Yes, well, actually, I'm a Philadelphia native, and I graduated from Villanova University and the Medical College of Pennsylvania. I did my residency at Hahnemann University and at Pennsylvania Hospital downtown. And for my very first job, I came to Montgomery Hospital in Norristown. That was back in 1982.
First job.
My first job.
Never left.
October of 82.
Stay in Norristown, right?
And I've been here ever since.
Right.
And it's a lovely community. I enjoy being here.
Fine. You married?
I'm married. Yes, I am. And I have 3 sons. My oldest son was born just before I came here, and he's 21. My middle son is 17, and he's a junior in high school.
What's their names?
My oldest son is Alex. He is going to be a senior at the University of Pennsylvania. My middle son, Mark, is going to be a senior at Harriton High School in Lower Merion Township. And my youngest son, David, is 10, and he will be a 4th grader next year. Mm-hmm.
Okay. And your husband?
My husband.
His name is?
Peter.
I'm going to give him a...
Yeah, my husband is Peter, right? And he's a management consultant.
That's great. So you have a very busy life. Okay?
I do. Yes, I do.
So now your education, okay, everybody, when you go into a doctor's office, you see diplomas on the wall and everything. Tell us, now you went to what's...
Yes, I graduated from Villanova University.
Local? Right.
Local, mm-hmm. And then I went to the Medical College of Pennsylvania in Philadelphia, now part of Drexel University College of Medicine. And while I was at medical school, I was influenced by a number of female physicians, several of whom were in the oncology field. One was a radiologist, one a radiation oncologist, and medical oncologist. And I was very interested in the field of oncology, and that was the specialty I chose to go into.
Well, you hear so much about a lot of doctors are leaving Pennsylvania. You're not leaving us, are you?
No, not right now. No. I hope not.
That has to do with insurance and stuff like that.
Yes, unfortunately, there is a malpractice crisis in the state of Pennsylvania, and the insurance rates for physicians has gone up so high, and it's just gotten to be so exorbitant that it's very difficult even to obtain insurance. And the rates are going up so high that many doctors are leaving the state of Pennsylvania. I believe the numbers are 500 physicians have left southeastern Pennsylvania in the last year alone.
No kidding.
Yeah.
Wow. And is the governor or somebody doing it, President of the United States, or somebody doing something about it?
Unfortunately, the Democratic governor does not seem to be truly interested in malpractice and tort reform. There was hope. There was a commission that he set up to investigate the problem, but apparently the committee had many trial lawyers on the committee, and it just seemed that it was stacked up against the physicians. So it doesn't look like we're going to be getting the reform that we really need. Well, I think it's going to have to come from the national level.
We have to start doing something. So, talk to your legislator, talk to your congressman, talk to your senator, talk to somebody, because, health is very important today, more than ever. And now, you say this word oncology, right? Mm-hmm. And that means?
Oncology is the field of cancer. Mm-hmm. And there are various specialists who deal in the field of oncology. Of course, we have our diagnosticians, the radiologists who do many imaging studies to identify the cancers, the pathologists who interpret the biopsies that are obtained by the surgeons. And then the three main specialty areas that have to do with the treatment of cancer include surgeons, radiation oncologists who use radiation to treat cancer, and medical oncologists who use chemotherapy for cancer treatment. Yes.
And that's chemo. You have to take it, like if you get radiation, it's every day of the week?
Yes. Usually radiation treatments are given as a series that can take from 6 to 8 weeks of daily radiation, Monday through Friday. Yes. Whereas chemotherapy is delivered in a little bit of a different fashion. People get cycles of chemotherapy, so they may get chemotherapy once a week, every 3 weeks for 4 months or 6 months. And there are other various regimens. There can be a chemotherapy that's given daily for 10 days with injections on day 1 and day 8, and then that cycle is repeated once a month for 6 months. So it takes longer. In the long haul, chemotherapy is given over a more protracted period of time, whereas radiation is given over a more concentrated period of time.
What's the most common type of cancer?
Right. Among adults, the most common types of cancer are lung cancer, cancer of the breast in females, cancer of the prostate in males, colorectal cancer, bladder cancer, and then lymphomas and other types in lesser degrees, cancers of the uterus, the gynecological tract, and the GU tract.
Is there an age group that's most?
Yes, actually, the incidence of cancer increases with age, and as you get into the 60s and 70s, that is when the peak of cancer exists. Among children, it's a small number of children who are diagnosed with cancer. They tend to have different types of cancers like leukemias, lymphomas, brain cancers, neuroblastomas, and these are in general not seen as frequently in adults. Among adults, the most common types I mentioned.
Do we have many patients of the high school age with cancer? Is that?
No, actually the incidence is quite low, although in that age group we see Hodgkin's disease, we see some non-Hodgkin's lymphomas, and some testicular cancers. Lymphomas are tumors that involve the lymphatic system. And in
Is that
general,
mostly girls?
No, equally among girls and boys, right? And Hodgkin's disease is a type of lymphoma also that is seen in a young population. It's a kind of disease that before 1960 was almost invariably fatal, but now our cure rates are in the range of 90%, and that's because of the availability of radiation and chemotherapy that's made such a big difference in the survivals.
Is it a scare, or a lot of people saying, boy, a lot of cancer in the Montgomery County area, the eastern part of Pennsylvania. They say there's a lot in New Jersey and Pennsylvania. Are we in a high-risk area, or is that just talk?
The diagnosis of cancer, actually cancer is the second leading cause of death, second only to heart disease. And as the population ages...
Wait a minute, run that by me again. What was that now?
The most common cause of death is heart disease, and second is cancer. These are the big two killers. However, part of that is due to the fact that we're doing so much better in other areas of medicine. For example, in the past when patients weren't treated for diabetes, many more patients died from complications of diabetes, from strokes, from heart disease. Well, heart disease is also associated with diabetes, influenza, infectious diseases. Now, because we have such excellent antibiotics and we have immunizations against communicable diseases, that we see fewer and fewer cases of influenza, of stroke, tuberculosis. That was a big killer years ago. We no longer see that. And as those diseases have fallen away and infectious diseases have fallen away, we see more of cancer and heart disease, which are both diseases in general of the elderly population. And we do have a population that's living much longer than ever before, and so they are now having to deal with the diseases of the elderly.
Well, we're living longer, right?
We certainly
are. So the longer you live,
That's
You
right.
wind up
Anything
with
can happen.
everything. You're
Sooner
sure
or
to
later,
get
you're going to get something.
You're going to get
Yes.
ingrown toenails, you're going to get cataracts, you're going to get just about everything. The longer you live, you'll wind up with everything. See?
Yes.
So, but like you're outlining here, different preventions and also new techniques that we're using here. But what's a good prevention? What should people be doing to live a healthy life as far as, not getting, like I say, if you mentioned something about different countries are subject to getting cancer or so because of the environment or whatever they have around them.
Right. Well, I think if you remember what your grandmother told you, to go to sleep early, get up early, to eat properly, don't smoke, don't drink, live in moderation, and you'll live to be healthy, wealthy, and wise. There's a lot of truth in that.
My grandmom used to put garlic around my throat to get rid of a sore throat. So I don't know if you still use that.
A lot of people are taking garlic today. But I think the most important thing that people can do to keep their health is to avoid smoking. Smoking is responsible for so many cases of lung cancer, not only cancer, but also heart disease, peripheral vascular
from
disease.
smoking.
Yes, they're even attributing some people who lose their hearing lose it because the blood supply to the ears is not working properly. The nerves for your hearing are affected by a diminished blood supply, and smoking affects small blood vessels. So actually, impotence is associated with smoking, peripheral vascular disease, diminished hearing, emphysema, chronic bronchitis, all kinds of respiratory diseases, and then on top of it, lung cancer. Probably 90% of lung cancer could be eliminated if people didn't smoke. And lung cancer is responsible for a significant proportion of mortality from cancer. So that's the most important thing, quitting smoking. Also, drinking in moderation. Drinking can be associated with cancer of the esophagus. Actually, smoking is also associated with cancer of the cervix, and even pancreatic cancer. It has some association with smoking. So smoking is the best thing that you could avoid.
In other words, that's a good, you say, well, how can I prevent something? Stop smoking.
Correct.
That's a prevention.
Correct.
Okay?
That's right.
But you may get cancer some other way with,
Right.
there's no prevention that you know of,
Correct.
at that point.
There also is some thought that the American diet that consists of a lot of high animal fats can be associated with colorectal cancer and possibly with breast and prostate cancer as well. It's hard to really prove it, but it does seem that there is an association. And one interesting epidemiological fact is that women in Japan have a very low likelihood of getting breast cancer. Women who move from Japan to the United States have an intermediate risk, and then the children of Japanese immigrants to the United States have just as high a risk for breast cancer as the American population. And that indicates that there must be something in the environment or something in the American diet that contributes towards the development of breast cancer.
Are they working on that? I guess every day.
They're studying it, and that is one of the reasons why they think there is this association with the American type of a diet and the association with breast cancer.
I remember a comedian would say, always remember, a family that smokes together chokes together. So, it's something to think about, right?
That is something to think about. Secondhand smoke also is a risk for children. And in fact, in our hospital, we've seen a few cases of cancer of the vocal cords occurring in people in the age of 18 or 20, and the only risk factor we could find for them was that they were living in a household where there were many smokers. So secondhand smoke is not good for your children, and also it sets the wrong example for your kids.
Whenever you hear somebody tells you somebody has cancer, so right away they jump to conclusions or so, and the fear is there. And you often wonder, should a person that finds out that he's diagnosed cancer, should he keep that as a secret, or should he share it, or is that going to be more of tension and cause him more problems, or should he share his problems with someone?
Well,
it's therapy, I guess.
That's a personal decision, but to me, I believe honesty is the best policy, and the best way to handle a problem is to face it head on. And I think certainly among family members to share what's going on is important. The family is your support structure, and if you don't share with them what's going on in your life, they won't be able to help you either.
Yeah. What, you're talking to people that be aired, and here at Norristown High School, students here are televising this, and we have an audience of close to 20,000 homes that this goes into. What is something you can share with some of the people that you as a doctor that sees patients when they come in and you're treating them? What's something you can, good advice or something?
Right. Well, I think the most important thing is for people not to be afraid. Many times, years ago, the word cancer was hush-hush. Nobody talked about it. People could have cancer growing in the breast or in the rectum. They would know about it, but they were afraid. There was a stigma attached to the word cancer. They were afraid that the diagnosis of cancer was a death sentence, and therefore they were afraid to do anything about it. But now there are so many treatments, and we know that early detection offers you the best chance of cure, so it's much more important to have strategies for early detection. Early detection ensures your best chances for cure. And let me talk about a few different types of cancer. Breast cancer to begin with. Prior to the 1960s, we didn't really have good diagnostic tools, and most of the time when people presented with breast cancer, it was advanced and many people died. Then came the era of mammography, where we began to detect tumors that were so small that they weren't even palpable. And I can just give you a statistic that intraductal cancer, which is a form of cancer that's confined to the breast ducts that hasn't spread through the wall of the ducts and is like 100% curable, well, the incidence of that prior to 1980 was about 2%, and nowadays the incidence is 30%, and you can attribute that solely to mammography, which can detect tumors before they're palpable and before they've spread. So early detection affords patients the best opportunity for cure. Also, when women detect the breast cancer at an earlier stage, they are in a situation where they don't have to have a mastectomy. They can have more limited treatment. Local excision or a partial mastectomy followed by radiation affords equal cure for breast cancer as does mastectomy. So early detection gives women better treatment options. Also, when the tumors are found earlier, there's less need for chemotherapy. So I think early detection is extremely important. I can say the same for colorectal cancer. Colon and rectal cancer are 100% curable if they're detected at the earliest stages. So it's important to detect polyps. And how do you detect polyps? Well, that is through colonoscopy. Colonoscopy is a study where a tube, a fiber optic tube, is inserted through the rectum and it's passed through the colon, and the surgeon or gastroenterologist inspects the interior surface of the colon. And if small polyps are detected, they're surgically removed. A polyp that is not removed within 3 or 4 or 5 years can turn into an invasive cancer. And once the tumor becomes invasive, then there's the opportunity for the tumor to spread to the lymph nodes or to distant organs. So if people would get their colonoscopies on a regular basis, check it out, and that's the best way to diminish the death rate from colon cancer.
That's great. All that information, and you're just like you're like, I used to say old pro. You're a pro, okay? I'm using that term as a boxer, but for someone that's in this business, and in Norristown, your whole life is as far as being since the time you get out of college, right here in Norristown.
Yep.
Right. So so Norristown, we're in pretty good shape. We have a good hospital here. Now, how about the American Cancer Society? We hear a lot about that. What's their function?
Yes, the American Cancer Society is a voluntary organization whose mission is to diminish suffering from cancer and whose goal is to encourage people to have early detection and prevention of cancer and support services for family. So let's go back to the 70s. If you can recall when there were major drives for mammography screening, for PSA, or prostate-specific antigen, blood studies, and evaluations for prostate cancer. The drive to have colonoscopy for colorectal cancer. It was the American Cancer Society who first held these massive publicity campaigns to educate the population, and they encouraged hospitals to have free screenings for patients to encourage people to come in. So they were really the group that was at the forefront of publicizing cancer and its treatment and encouraging the public to have early detection. It's a wonderful organization. They also started the group that's called Reach to Recovery, which is a group of women, breast cancer survivors, and they match up individual volunteers with patients who are diagnosed with breast cancer, and those women go and counsel the new patients and tell them what treatments are available, talk to them about breast prostheses, if the patient had a lumpectomy, and breast conservation. They match up a young patient with a young patient who's gone through the same thing to give them moral support and encouragement. They've also encouraged support groups throughout the area. It's a wonderful organization.
Right. The reason why I asked, I have a niece that's in charge of Cape Cod, Massachusetts, the American Cancer Society. She has that whole region. And I told her about my little TV show, the Cisco show, and she said, well, you got to get somebody to talk about cancer. You know, that's the big thing today, you know. And I said, well, all right. So here you are, and I'm glad that you're able to do that and inform us good information that everybody should know, you know. And well, tell me, what else you want to tell me?
Well, certainly I would like to encourage not only the adults to undergo the normal preventive screenings that are important, and I'll just go through them again. For women, mammograms are recommended on a yearly basis after the age of 40. If somebody has a family history of breast cancer, they might want to start their screening earlier. And usually we recommend 5 to 8 years younger than the onset of the disease in their relative. For men, well, let's talk about young men.
Yeah. Young high school men,
and
right?
going back to the high school period, yes. It's not common, but it's not uncommon to develop cancers of the testicle. And that's a very private area that people don't like to talk about. But there is a thing called a seminoma of the testicle, and there are other types of cancer of the testicle, and I guess everybody knows the bicycle rider.
Yeah.
I can't think of his name right now.
Cunningham, is it something? Over in Europe, he's up in the Alps.
Right, the long-distance bike
Cities.
rider, and he actually had a non-seminomatous cancer of the testicle that had actually spread pretty dramatically, actually into his brain, and he had chemotherapy and was cured from that. But the main thing is that when these cancers are detected early, they're very curable. And so for young guys in the high school age group, they should do testicular self-examination. And if they find something, they should bring it to the attention of their doctor. In most cases, these cancers are highly curable, but they do occur in the young age group, so guys should be aware of that. Prostate, I wanted to talk about that because a lot of men are a little embarrassed about having rectal exams, and they don't want to talk about it. It's very interesting when we have screenings or any kind of programs that have to do with female cancers. There's a lot of attendance at the conferences. People are very interested. People want to talk about it. But the guys are a lot more private. And if you want to have a conference about prostate cancer, probably nobody will show except for the wives. So we would like to encourage the gentlemen to have their annual rectal exams, and the PSA testing should be done yearly after the age of 50. We do find that in the African American population that prostate cancer can start at a younger age, and we recommend for the yearly screening to begin at the age of 40. Again, for colorectal cancer after the age of 50, we recommend a screening colonoscopy, and that should be repeated every 3 to 5 years.
And we get back to prevention. Don't smoke, okay? Another comedian told one time when they come out with cigarettes, the guy said, well, the cigarette come out with a filter. So they come out with a filter, less chance of getting cancer. The guy come out, then another company come out with a double filter. So the guy said, well, geez, if the double filter, less chance of getting cancer, I'll put 5 filters on. So he puts 5 filters in, takes a drip, and he got a hernia. So you know, you got to watch the preventions and all. So I really enjoyed. I want to thank my niece, Dee Yater, up in Cape Cod, for mentioning to me that get someone there to talk about cancer. Uncle Hank, I'm telling you, we want people to know what's going on out there, prevention. So I want to thank you, and I'm telling you, I've learned a lot, and I'm listening, and usually I do all the talking, but I let you do the talking because you got a word, you put it right where it's at. So I want to thank you, and
Thank you for having me.
thank you
It's a
very much,
pleasure.
and thanks, and I'll see you my next show, and God bless.